It was the communities themselves. They rose up, they filed the applications, they fought for the funding, and they now operate and direct the care that's provided in those communities. And as you know, health centers were founded not just to be agents of care in communities with far too little of the same, but also to change the status quo and change the way that care is organized and delivered.
There couldn't be a timelier topic since the actual implementation of the new healthcare reform. It's only about to start. We all hope better sooner than later. But there is still a lot of work ahead of us.
It's transformational qualities in relation to how Americans relate to health and health care. There are many provisions of the law that go beyond simply the market nature of American health care and the market nature of our health insurance arrangements, but that actually touch on how we think about our health, how we think about health care, how we get care, how we use care, where we go for care, and how we as a society work together to attempt to change the conditions of health in the United States.
To write down for yourself, how do you define community? How do you define participation? And how do you think community participation could be used in better designing and implementing the healthcare system?
The heart of healthcare is really working not only to provide treatment and services for folks as they need them, but also to assure the conditions under which health happens for everybody. And so that creates lots of opportunity for community to be engaged, to assess what's going on in local situations, to be engaged in bringing about changes in the environment, doing all the things that it takes to assure possibilities for health.
Well, I think in the long run, basically, we are individually responsible for our own health. And so the decisions we make is what makes us better or worse. Where things work more on an aggregate level is when people get together and make decisions and work towards certain things. And we do know when communities or groups of people get together and make those decisions, whatever health intervention to improve health is done, it is more sustainable as communities and people get ownership of that intervention.
Which is, you want to get away from the idea that most citizens are passive citizens, that they only expect in the social services. The idea is that they are active citizens as well. It's only that they don't have the opportunity, or we do not make it easy for them to get involved. We usually try to keep everything very complicated, technical languages and so on. But if we were to use the everyday language, and we were to make clear how the issue is affecting the citizens, then they become very, very actively involved.
So this is the health professions, and try to bring us together to work collectively, not only on a voluntary basis, but with communities for improvement of population health. And I'm here today, I think as most of us, I feel like I'm in a family, that we're really looking at how we can get participatory communities, people, families, along with the civil structure, and along with health providers to be more effective, to work together to benefit not only our individual health, but to make our communities a better place to live in.
That the reason people have poor health is not simply that they don't have services, but because they also are unable to live in conditions and environments that are detrimental to that health. So I would give every first-year medical student a course in the social determinants, so a doctor could see where they are positioned in society and what their influence is in health provision and improvement.
Well, I would hope that what they're going to get is the idea of community participation not being as one of others or one more activities that we do while they're even healthcare services. That hopefully they will get the idea that community participation is an active action of citizens.
But it's equally important that while a physician in training, or any health professional in training, has to see the individual in a larger context, it's also important for those of us in public health who are teaching public health students to understand the clinical sick care as well as the health promoting care. So we need to also know more about the clinical profession of medicine and health professions.
We need the people, we need the community, because they have the experience of simply what they live and what they need. So there is no need for education if you want to make them participate. But basically we need us to be educated to be able to communicate, because we are not trained to speak to people, to act just outside our university offices. So basically I think if there is one side to be educated, is the academic, it's the authorities, and not the community, not the people. And I'm not like